Hello and welcome to the second module of PHM 613, whereby we'll be discussing healthcare as a business. There are three learning objectives. First is discussing how, describing the role of market-oriented healthcare system, describing what the perfect competition is, and describing the role of power in policy making and how that influences healthcare markets. And one of the ingredients of a stable healthcare is having to make decisions over improving healthcare quality, expanding access, and reducing cost. These three prongs of where how stable healthcare system works is something that is the ideal. Being able to achieve all three is ideal, but it's in practice not quite how it works out. Some of the times the decision to improve quality comes at the cost of access. And some of the times, in order to reduce cost, there may be, less quality that can be offered, or less, the access is kind of restricted and limited. So that is some of the decisions that health systems have to get into when it comes to health financing. And this is because there is limited resources. Even the wealthiest country does not have the money to give everybody the highest quality of healthcare and at the lowest possible cost of it. It's just not something that is currently something that is happening. So what that then means is that some decisions has to be made. Some of the times it kind of involves rationing access to health. And a market based system relies a lot on price mechanism, whereby you have only the people who are able to pay get to be the ones who can who can attain the highest quality of healthcare service, and thereby kind of limiting or restricting access. And so while the US healthcare system leans very heavily on the market system, that doesn't mean that this is all that is available. Some healthcare services do come under government control. For instance, you have Medicaid for low income households, you have the Children's Health Insurance Program for household that are considered too rich to qualify for Medicaid, but are too poor to be able to afford private health insurance. And then you have Medicare, which is for seniors. So what happens, particularly with the US's reliance on their market system, means that in order to get highest quality of health, there is price and affordability kind of rations how much. Rations what services are available, to whom the services are available, and that kind of relies on the health economy approach of demand and supply, whereby what's what is demanded influences what is supplied. I'm going to use the example of I'm going to use Apple as an example, whereby Apple can almost afford to charge how much ever amount of money that he wants for the product, and somehow they still keep outselling. And right now, Apple doesn't even include headpiece and charging cables with their phones. but people were still buying. So there is a lot of supply and demand that is happening with that. But that doesn't quite work out that way with healthcare, and for so many reasons. One of which is that um, it really brings to question about how much power do healthcare consumers really have in determining how goods and services are produced, especially because a lot of healthcare demands really relies a lot on technological advancements that people kind of have to there's not a lot of demand that happens there. For instance, I'm going to use this example. If one has cancer, for an example, and there is a service that is available, latest technology that brings great hope for increases survivability, people are very likely going to go with that, uh, regardless of whether they can afford it or not, because you do want to use that. So that's what is kind of leaning on. So it's not much of demand and supply, because in this case, in the case of the technology versus cancer, it is not demand that is influencing supply. So that's one of question that comes in: just how well does the market system works in healthcare industry, and and there is across the world there's a lot of healthcare costs that is rising in terms of the rate that healthcare costs are increasing. A lot of that depends on the technological advancement, and this is happening across the world in as many different healthcare systems as there are, not just in the US with its market-based system. But one of the things that why technological advancement kind of thrives in the US market-based system is because the government kind of plays a weaker role when it comes to cost containment. An example would be there in some healthcare systems, there is a capping on how much healthcare providers can charge in terms of healthcare services. That doesn't really work like that in the US. So then the question that becomes, with the US having the government having a weaker role in price containment, what is the cost of that related to healthcare industry? So now we want to talk about the perfect competition. Um, so the idea of the perfect competition comes from Adam Smith, an inquiry into natural causes of health of nations. Sorry, wealth of nations. Um, the basis of market competition is that one individual doesn't have the power to set the price of a goods and service. That is the basis of that, meaning that there is meant to be a high degree of competition that is coming in, whereby one's firm production decision doesn't have a meaningful or adverse effect on the performance of the whole healthcare industry. And now the question is that really how it is in healthcare? The idea or the philosophy of the perfect competition is that individual producers or consumers do not have any real market power to be able to really influence the industry. But the question is, does that really work? Health The perfect competition makes a lot of assumptions. One of it is utility maximization, which is the ideology that people are interested, or they seek to attain the highest level of satisfaction from their economic decisions. For example, the pursuit of the highest satisfaction determines how much people, what economic decision an individual, a corporate is making. So that is the one assumption. The second assumption is that there is profit maximization, and this is from the provider's side, which says that providers, really seek to get the highest return on the investments, and this is after they've, kind of discounted for things like market, sales price, production price, and all of that. So markets, the perfect markets are, you know, kind of trying to sell the idea that so long as any of these assumptions, utility maximization or profit maximization, is violated, firms and consumers are not able to behave perfectly as the way that the market, perfect competitive market is, which then leads to market failure. You can already tell that utility maximization is not quite something that works in the healthcare as industry. I've used the example of cancer and technology. It's not really about it's not the highest decision that is really making it. People are going to make decision to save the life of a person, regardless of what how much is going to cost them, or if they're going to be in debt for the rest of their life. And it's not so much satisfaction that is kind of pushing this, but a lot more on desperation, because for the most part there is no alternative when it comes to the how what do you do. Market perfect competition is relying on the fact that no one industry is making that decision for you, which means that there's things are happening, and if one provider is not giving you the best that you can get, you kind of go to the other provider. That's not quite happening in the healthcare business, in the healthcare industry, and hence we have the problem of market failure. As you can already guess, market failure just doesn't work with the with the healthcare markets for a number of reasons. One being the licensure that happens in healthcare, whereby one has to be licensed to be able to operate. And with the cost of health education in the US, it costs a lot to get this license, and it costs a lot to be able to go to medical schools, or all the different kind of providers. There's a lot of money that comes out of it, whereby you have people graduating with hundreds of thousands of student loan. They are going to seek to get the highest payment that they can for providing the healthcare services that they are providing. And remember, profit maximization is somebody is going to have to pay for it. And the person who is going to have to pay for it, for the most part, is the consumer. And also because of the licensure, it also reduces the number of people that can be in this potential competition, because who are the people who can afford to go to, afford in theory, in terms of, if you're going to go to medical school at student loan, there is a lot of things that it inhibits a lot of the times people who cannot afford to pay back their student loan. Even if they get a job, they'll probably have to pay for student loan for the rest of their lives, and therefore that becomes a barrier to entry, even in terms of licensure. And what that then does is that those who are able to get through the door, there's a lot less competition of what is happening, because now your option of going, if one person doesn't give you what you want, you go to the next person. the potential of having that kind of situation or that kind of environment or competition kind of shrinks. So that makes it difficult. And of course, there then is the problem of consumers being able to make the perfect decision that comes for them. How do you determine which, let's use, for example, what happens a lot is that health consumers or patients sometimes don't really know how much the service is going to cost them until afterwards. And let's just, for example, if you have a insurance package that says that they're going to cover 0 to 90% of the cost, and then you know you don't really know how much that is going to cost until the bill comes. There's not a lot of decision making in terms of your economic power that comes out of it. You kind of have to rely on the physician being able to recommend the best services that you get. And sometimes not even the physician knows how much it's going to cost until that happens. And sometimes, even though they're the ones who are kind of in quotes making the decisions, they're not really the ones making the decisions because let's use for example they want to provide this service to a patient, and that service is not being covered by the insurance, or is only covered in parts, and if there's a cheaper option, the physician can go with that. But if there's no cheaper option, or and they kind of have to go with what is available. So in a way, the decision of which service to provide isn't so much being made by the physician, neither the healthcare provider nor the customer, but is being made by the insurance company. So that of course leaves creates a problem in the system. And this is even before you account for things like physicians over prescribing or under prescribing, rather than having to go with what is best for the patient. So it perfect competition, it doesn't work in the healthcare system, which is a big problem. And so that is one of the things that really comes in, and with especially with the US being a market based system. So I wanted to talk about power and policy. So beyond there are a number of things that is influencing the market and healthcare market beyond just the people who have the power to make financial decisions. Some of that has to come with power. Who has the power? How much power do they have, and how do they wield their power? In this image you see here, you see the the policy making process. You have agenda setting, that is the triangle in blue. Agenda setting, implementation, and all that. That is just one, you know, um, bucket of how power and policy interact. You have contests being there, you have actors being there, you have content and structures. These have such a big influence on what policy gets made, what policy even gets into the into makes it into discussion, and what finally gets implemented and how it gets implemented. An example would be the ACA as it is being implemented today is quite different from the way it was originally designed. A lot of bargaining had to happen before it got passed. Regardless of whatever the condition which it was passed, it is still a challenge. So the how power kind of plays in policy is in terms of an individual or group's ability to control or allocate resources, and this could be either in a formal influence, or it could be in a formal influence. Formal influence kind of happens with elected officials, and while informal is more influence, but whether formal or informal, a lot is going into in terms of money, in terms of people. There's a lot of influence that is going on with that. And an example would be what happened when Medicaid and Medicare was enacted many, many years ago. The American Medical Association really, really fought against it. And they put in a lot of money in fighting against it. They put in a lot of manpower in getting physicians to oppose it. At the end, they weren't quite able to get that done, but they did give it their best shot. And today, you don't have physicians being able to wield that amount of power, or even in any way have any significant influence on it. What we have today is, health insurance being able to be the ones making a lot of decisions in terms of what is possible to be passed, and who can pass it, and how it will be influenced. So, when it comes to the philosophy of market, there are two sides to it. You have the market justice, and then you have the social justice. The social justice is kind of the philosophical view of the left, and is built on the social construct, while the market justice is a lot more the philosophical view of the right, and it's built off John Locke's separation of power and natural rights of man. So this is the characteristics of the market justice. A lot of it, the market justice kind of is works as an economic. It treats health as an economic good, whereby who gets healthcare service depends on who is able to pay for healthcare service. Social justice approach kind of sees health as being a social good, and so there's a whole lot less reliance on one's ability to pay, determining who receives healthcare service. The social justice is very much the foundation on which universal health coverage, built on, and but whichever one, whether social justice or market justice, they both have implications. Whereby with the market justice you have rationing being based on ability to pay, and social justice being based on public solution to social problems. And so both of them have a way that it functions, so you kind of have to try to see them from both sides. So that is where I end for today's class. Remember to use the Q&A board if there's any part of this lecture, or that is not quite clear to you, or if there's any part of the assignment that you feel you need further clarification on. Do you have a lovely day? Bye.